Good evening. I am Dr. Vivek Kumar. I am working as senior consultant and head of neurology at Max Hospital, Purple, and I have 15 years of private practice, and I have a special area of interest in epilepsy. As the month of March is considered as a epilepsy day, we celebrate on in the March, and the entire month of March we celebrate as a month of epilepsy. We need to the purpose of this is to improve the awareness, general awareness, because of lack of awareness about this disease, we often are finding it difficult to treat the patient because they do not come to us in proper time, and they often have a problem in taking the treatment for the proper treatment, appropriate duration. Epilepsy is one of the commonest neurological disorder. In fact, it is considered the second commonest neurological disorder after headache. Yet, large number of people who have epilepsy do not seek proper treatment. And one of the most important reasons for that is that there are so many myths associated with this disease, and as a result there is a stigma also associated with epilepsy, and that has resulted in very significant amount of these patients not reporting in time and not seeking appropriate duration of treatment. Now, so that is why it is important to clarify and clear various myths and misconceptions associated with this disease, and that is what we are going to discuss today. Now, since ancient times, epilepsy is considered to be a curse of God, or it is said to be an effect of evil spirits. And that is why most of these people of epilepsy, especially in rural population, they consider it as a curse, and they do not seek medical attention for which this disease can be treated. Now, because of this, they seek various other kinds of treatment or various other kinds of therapies. It is often said that हमारे मरीज हमारे बेटे को या हमारे रिश्तेदार को ऊपरी हवा का असर है या झाड़ फूक कराना है. They come to us, they say often refuse the treatment, or they come to for the treatment and then they don't come for follow-up. So this is a common myth, but epilepsy is a fact that epilepsy is a brain disease. It occurs because of generation of electric current inside the brain, which results in an epileptic attack, and it requires proper treatment and evaluation. So epilepsy is not a curse, and there is no evil spirit associated with this disease. Then second common myth is that epileptic patient cannot lead a normal life. And that is why many people do not discuss this disease or their problem with a professional colleague, or they do not report this to anyone in the society or in their professional group. Now, it should be very clear that an epileptic patient is as normal a human being as each one of us. And epilepsy is a disease which can affect from birth, right from the birth to anyone in an older or elderly population, and it can be treated. A person who has epilepsy can lead a perfectly normal life, except for certain professional activities like driving or a pilot or operating certain machineries. Most of these people can be employed usefully in most of the professional or occupations. Then the problem arises with women with epilepsy. There is so much stigma associated with this disease, that is whether a woman can marry, whether they can bear child, whether they can breastfeed their children. So a woman with epilepsy often find it very difficult for as far as the social commitments are concerned. So it should be seen that a woman can marry, can have normal children, and can also breastfeed. There is no problem with the bearing of children. The only thing that they should discuss this disease with their doctor. They should, whenever they have to plan the pregnancy, they have to discuss with the neurologist, and the treatment can be modified with the most safe and appropriate drug that will have a least effect on the child. So the child bearing should not be a problem if it is appropriately discussed with the doctor and the appropriate treatment is taken. Similarly, as far as breastfeeding is concerned, there is no problem with the breastfeeding if you are taking any treatment for epilepsy. All you need to time your breastfeeding as well as taking the medication. You can take the medicine after feeding your child, and then after 2-3 hours you can again feed, so that the peak level of the drug is not there when you are breastfeeding the child. So there is no problem with the breastfeeding. So the stigma associated with women with epilepsy should not be there. Anyone or any woman with epilepsy can lead a normal life. They should be able to marry, they should be able to have children, and they should be able to breastfeed. Then there is a myth associated with as far as the how to treat a person who has an acute attack. What to do when a patient comes or around you develops an acute epileptic attack. There are so many people who gather around anyone who has an attack. They often try to insert a spoon or something, some object in the mouth. Now this one should be very clear what all we should do during an epileptic attack and what all we should not do. कभी भी जूता सुहाना, मुंह में कोई चम्मच रखना, पानी डालना, मुंह में कुछ भी डालना, ये सारी चीज़ें we should avoid. Best thing is to place a person who has an attack in a safe position. Do not crowd around him. Do not place anything in his mouth. Do not feed him during an epileptic attack. Loosen any clothing around his neck. And do not crowd, do not panic. Most of these attacks, they last for a few minutes, 2 to 5 minutes. If they are not getting corrected in 4 to 5 minutes, you have to call your doctor. So during an attack, you should not put anything in the mouth of a patient. You should make him lie on one side so that the secretions or any frothing from the mouth comes out from the side. He should not choke himself. So any person who has an attack should be made to lie on one side, either on the left side or on the right side, and nothing should be placed in his mouth. So all these things will help in preventing any choking or any aspiration of the secretion into the. Now let us all take a stand against epilepsy, and let us improve the awareness about this disease, which is a potentially treatable disease. And more people should be able to know what is this disease and that it is a treatable disease, and we should all try to make people with epilepsy feel that they are as normal as each one of us. Thank you.